Jamaica yesterday recorded 45 new cases of the coronavirus, the highest one-day increase. The number of confirmed cases in Jamaica has now risen to 350. In a statement last night, the Ministry of Health said 11 of the 45 new cases are employees of the Alarca call centre in Portmore St. Catherine. 14 are contacts of a confirmed Alarca employee. The ministry adds that 10 are contacts of a confirmed case and 10 are under investigation. 178 of the 350 confirmed cases are employees of Alarca. Radio Jamaica News has been informed that Chairman of the Southeast Regional Health Authority, Sarah Wentworth Charles, is to receive a preliminary report today on the case involving Jodie Ann Ferron, the pregnant woman who was allegedly denied admission to several hospitals after she displayed symptoms of the coronavirus. She was first refused admission at Andrews Memorial Hospital, a private institution, as well as the Victoria Jubilee Hospital and the University Hospital of the West Indies. Our news centre has been informed that Mr. Charles has requested reports from the administration of the Victoria Jubilee and Spanish Town hospitals where Miss Ferron delivered her baby. After Miss Ferron gave birth, she was transferred to the University Hospital where she died. Health Minister Dr. Christopher Tufton yesterday requested an investigation. He said the probe will include a review of protocols in the public and private healthcare systems to identify possible system weaknesses, or an operational breakdown in the handling of the Jodie Ann Ferron case. In a Twitter post yesterday, Dr. Tufton said no one should be denied access to health care. And Andrews Memorial Hospital says it encountered challenges transferring Ms. Ferron to a better equipped facility after she displayed COVID-like symptoms. The hospital issued a news release yesterday outlining the series of events. More in this report from Vashan Brown.
Andrews Memorial says Miss Ferron was admitted to the hospital on Thursday to deliver her baby and started to show symptoms of COVID-19, including cough, fever and a shortness of breath. As a result, Andrews says concerns were raised about the safety of the patient and her baby because the hospital is not equipped with a functional intensive care unit to provide respiratory support and isolation facilities on the maternity unit. Andrews says it contacted the University Hospital and Victoria Jubilee Hospital about transferring Miss Ferron, but they refused to accept her. It says a plan was put in place to manage the patient by her physician. According to Andrews, on Friday morning, Miss Ferron's doctor recommended an urgent C-section. Her physician's team of independent anesthesiologists reportedly refused to participate in the surgery. As a result, the nearest hospitals with the required facilities, the University Hospital and Victoria Jubilee, were contacted, and again both refused to accept the patient. Andrews said it transferred the patient to the Spanish Town Hospital, where she delivered her baby after collaboration with the National Emergency Operations Center. Andrews says the patient was transferred to the University Hospital, where she passed away.
That report from Vashan Brown. In the meantime, opposition spokesman on health Dr. Maurice Guy is concerned about reports that the Victoria Jubilee Hospital did not accept Miss Ferron because it was awaiting COVID-19 test results for members of staff.
What is tragic, unacceptable, and cannot be condoned is the report coming that Victoria Jubilee Hospital staff was awaiting a result after 7 days of testing. At the same time, we have the Cabinet of Jamaica testing on the 17th, and 3 days later they had back their results. The frontline staff in all hospitals are the ones who interface daily with COVID-positive cases. So it is unacceptable that we can treat with some amount of urgency some results, and those that are attributable to our frontline workers, we treat them without any urgency. It is unacceptable. It cannot be condoned.
Opposition spokesman on health, Dr. Maurice Guy. Opposition spokesman on education, Peter Bunting, is calling for a task force to assist the education sector deal with the long-term effects of COVID-19. Mr. Bunting says the task force must, among other things, consider how to reconfigure the next academic year.
And we need a task force comprising the brightest minds across the stakeholder groups to really develop a plan for the next 12 to 18 months at least that is going to deal with mitigating the long-term impact of this lockdown period on our students.
Opposition spokesman on education, Peter Bunting. Prime Minister Andrew Holness last week announced that schools in Jamaica will remain closed until May 31. Educational institutions have been conducting classes remotely. Trade unionist Helene Davis-White says the government needs to start planning for a comprehensive stimulus program to follow the COVID Allocation of Resources for Employees CARE initiative. The Jamaica Confederation of Trade Unions president says while the CARE program is commendable, it is just a stopgap measure. Mrs. Davis-White says if a comprehensive stimulus program is not developed, the government could find itself not being able to pay its bills, including salaries for public sector workers.
As we speak, our public servants continue to be paid, but if our tax levels fall, that may have implication on for employment in the public sector. And we have seen in some Caribbean countries where they're asking public servants to take pay cuts and so on. We would not want it to come to that in Jamaica, and this is why we are saying that the government needs to use this as an opportunity to look down the road, do all the modeling in terms of what is maybe likely outcomes, and from that be able to develop a real stimulus plan.
President of the Jamaica Confederation of Trade Unions, Helene Davis-White. The CARE program has so far received nearly 500,000 applications. The Ministry of Finance is verifying the applications to enable payout by this Thursday. And head of the Hugh Shearer